All right, so let's jump into this deep dive on mental health and nursing. I mean, it's such a crucial topic for providing really good care. And you've sent over some really interesting sources this time, lecture notes, research articles, even some real world scenarios. So
Mhm.
it seems like you're really trying to get a good grasp on kind of the whole picture of mental ill health, the causes and the consequences, and then how you as a nurse can really make a difference.
You're spot on focusing on those aspects. It's definitely not enough to just know the terminology. We need to understand all the different factors that are influencing someone's well-being, the ethical considerations, and then, of course, the practical skills that you can use to make sure you're delivering really good patient-centered care.
Yeah, exactly. It's like we were trying to build this toolkit filled with insights and strategies that can help you navigate all the challenges of mental health nursing. And I think one of the first tools we should unpack is this biopsychosocial model.
Oh, that's a great place to start. It's a fundamental model in mental health care because it reminds us that we can't just look at symptoms without looking at everything else. We have to consider the biological, the psychological, and the social factors. All of those contribute to a person's mental state.
Right. So it's really about seeing the whole person, not just the diagnosis.
Uh-huh.
And I think that leads us perfectly into one of the sources you shared, Jessica's story. She's dealing with anxiety, but it's so clear that her struggles are tied to other things in her life.
Uh-huh.
Like she's dealing with financial insecurity, long work hours, and a lack of support from her community.
Her case just perfectly illustrates how social determinants of health can really contribute to mental ill health. It reminds us that we have to look beyond the surface. We have to understand the context of a person's life. If we only focus on the symptoms, we're missing a huge piece of the puzzle.
It really makes you realize how interconnected everything is. And it makes me think about another concept that came up in the sources, adverse childhood experiences, or ACEs. It's incredible how much our early experiences can affect us as adults and can really shape our vulnerability to mental health issues later in life.
Yeah, ACEs can include things like abuse or neglect, even witnessing violence or having parents who separate or divorce. And these events, they can actually change brain development. This can make someone more likely to experience anxiety or depression as they get older. It's not about blaming the past, it's about recognizing how those early experiences might still be playing a role.
For sure. It's so important for us to be aware of those connections. You also sent over this specific case study of Xiaomi, and she's dealing with anxiety now as an adult. She was really close to her father growing up, but lost her mother when she was a teenager. And now, years later, she's constantly seeking reassurance from her boyfriend and just feeling really anxious after moving to a new city.
It's interesting because we can look at Cian's situation and apply different models to see how they all fit together. Losing her mother, that was a major ACE, and that likely triggered a trauma response that could still be impacting her. And on top of that, her attachment style, which might have been shaped by her relationship with her dad, could be contributing to her anxiety in her relationship now.
Yeah, it really is complex, and it really highlights the importance of a really good and thorough assessment.
Yeah.
We need to gather as much information as possible to understand that person's unique story
Yeah.
and what led them to this point.
100%. It's like detective work. We need to piece together the clues to see what's going on.
Sure.
Now, while individual stories are really important, we also need reliable ways to classify and diagnose mental health conditions. And that's where these systems like the ICD-11 and the DSM-5 come in.
Right, these systems provide a common language for everyone working in mental health, which I imagine is super important for research communication and making sure that everyone is on the same page.
Yeah.
But the sources also mention some criticisms of these systems, like they can be a little rigid sometimes, right?
Yeah, that is one of the biggest concerns. Critics say that these systems can oversimplify complex human experiences by trying to fit everyone neatly into these diagnostic boxes. It's like trying to fit a square peg into a round hole. Everyone is different, and their experience of mental illness is going to be shaped by their own circumstances and their own perspective.
Yeah, and we can't forget about the issue of labeling. While a diagnosis can be really helpful for some people, for others, it can lead to stigma and negative self-perception. It can be like that diagnosis becomes the only thing people see.
Exactly. It's a double-edged sword. So it's our responsibility to approach a diagnosis with sensitivity and to remember that a person is so much more than their diagnosis. It's just one piece of information that can guide our understanding and our treatment planning.
Yeah, it's about finding that balance between using these systems as helpful tools and making sure we aren't reducing people to just a label. So where does the mental state examination fit into all of this?
The mental state examination, or MSE, is really important for the assessment process. It lets us look at a patient's mental state in a holistic way. It's about considering the whole picture, their appearance, behavior, speech, mood, thought processes,
Yeah, right.
even their insights into their own situation.
So it's like taking a snapshot of their mental state right now, which can be really helpful in understanding how serious their symptoms are and how they're coping. So we've talked about models, diagnoses, assessments, but then the question becomes, what do we do with all of this information?
That's where your role as a mental health nurse is so important. You take all this knowledge, the models, the diagnostic tools, the understanding of those social determinants, the assessment findings, and then you use it all to provide care that's effective and tailored to the individual.
Okay, and a big part of that is understand the difference between stress and distress, right? Those terms, I feel like they get used interchangeably sometimes, but they mean very different things, especially when you're working with patients who have dementia.
Exactly. Stress is a natural response to life's challenges. But distress is more severe. It can be completely overwhelming and even debilitating. It's like
Yeah.
stress is a little nudge, and distress is like a blaring alarm. And for people with dementia, they often have a reduced ability to cope with stress.
So even small changes in their environment or routine can trigger this really intense distress. And I know the sources talked about the progressively lowered stress threshold model, or PLST. That helps to explain this a little bit.
Right, so the PLST model says that people with dementia have a lower tolerance for stress. And over time, they become more sensitive to stressors. Imagine that their stress bucket gets smaller and smaller.
So it's really important for nurses to be aware of those triggers and to try to create a calm and supportive environment for them. It's about anticipating their needs and trying to minimize any potential stressors.
Absolutely. It shows just how important your role is in assessing their stress levels, figuring out what those triggers are, and then putting strategies in place to help them manage their distress.
It really is fascinating how all of these pieces fit together, from the social factors that impact mental well-being to the way someone experiences stress, and then the role that the nurse plays in providing support. It's like we have to understand the whole system
Yeah.
and how everything interacts.
And that actually brings us perfectly to our next topic, trauma-informed care. It's recognizing that trauma is really widespread and that it can have a huge impact on a person's mental health journey.
Yeah, one of the sources talked about Shamim. He's a young man with a history of trauma who was admitted to a mental health ward. He was really struggling and self-harming, and initially one of the staff members was really great with him and offered support. But later on, he was told that he couldn't choose who he spoke to, and he overheard staff members labeling him as manipulative, and then he just completely withdrew for the rest of his stay.
Shamim's story is a tragic example of what can happen when care isn't trauma-informed. It shows how we can accidentally re-traumatize people who are already really vulnerable. It highlights the need for systems and practices that focus on safety, respect, and understanding.
It is heartbreaking to think that he was let down by the very system that was supposed to be helping him. So what does trauma-informed care look like in practice? What are the things that nurses can do to make a real difference?
Well, one practical framework that's used in Scotland is called the FAIR approach. It helps you apply a human rights-based approach to mental health care.
Okay, I'd love to hear more about that. What does FAIR stand for? And how does it translate into action?
So FAIR stands for Facts, Analyze Rights, Identify Responsibilities, and Review Actions. It encourages us to look at the facts of a situation objectively, to analyze which human rights are involved, to identify who's responsible for taking action, and then to review the actions to make sure they align with those rights.
Okay, so instead of asking, what's wrong with this person,
Mhm.
we shift our perspective and ask, what happened to this person? And how can we make sure that our actions are upholding their dignity and rights?
Exactly. And that shifting perspective is also a key part of recovery-oriented practice, which focuses on empowering individuals to participate in their own recovery.
Right, it's recognizing that recovery isn't just about managing symptoms. It's about helping individuals define their own goals and to live a meaningful life, even with those mental health challenges. And one of the sources mentioned the CHIME framework as a tool to support recovery. Can you tell me a little bit more about that?
Sure. So Chime Shine stands for connectedness, hope, identity, meaning in life, and empowerment. Each of those elements is super important for a person's well-being and their sense of purpose.
Okay, it sounds pretty comprehensive. But how can nurses actually use those concepts in their daily work? I mean, it's one thing to understand the framework, but how do you translate it into action?
I'm glad you asked that. Let's take meaning in life as an example. As a nurse, you can help your patients reconnect with activities or goals that make their lives feel meaningful. That might involve exploring their values, helping them think about activities that they used to enjoy, or even just creating opportunities for them to have meaningful conversations and social interactions.
So finding those ways to tailor the approach to each person's needs and aspirations. But the sources also talked about how some systemic issues and biases can actually hinder recovery. They share the story of Louis, whose journey is being affected by a lack of understanding of his cultural background and his experiences as an asylum seeker.
Louis' story is a good reminder that culturally competent and individualized care planning is essential. We can't use a cookie-cutter approach in mental health care. We have to meet people where they are and come up with plans that consider their unique circumstances and backgrounds.
Yeah, absolutely. Everyone's recovery journey is going to look different. And speaking of journeys, it seems like therapeutic skills and building relationships are a big part of that.
For sure, building a strong therapeutic relationship is at the very core of mental health care. It's about creating that space where the patient feels safe, heard, and understood. It's about showing empathy, being genuine, and demonstrating unconditional positive regard.
The sources mention some specific techniques like using open-ended questions, reflective listening, and validation. Why are those techniques so important in mental health nursing?
Those techniques are great because they show the patient that you're really listening to them
Yeah.
and that you're trying to see things from their perspective. It's not about giving advice or trying to solve their problems. It's about being present with them in their experience.
Okay, so acknowledging their feelings and their experiences without judgment. But of course, communication can also cause harm in mental health care, which is where that concept of iatrogenic harm comes in.
Right. Iatrogenic harm is basically any unintended negative consequence of medical treatment. It could be anything from side effects of medication to insensitive communication, even things that make the patient feel worse or re-traumatized.
Oh, wow. One of the sources shared a story about Fiona. Her first experience with mental health services was actually really traumatic. The police brought her to the hospital, and she felt like her rights were being completely ignored. And the staff's response, physically restraining her and putting her under constant observation, only made things worse.
It's a really powerful example of how iatrogenic harm can happen, especially in those acute settings where things can escalate so quickly. It shows how important it is to think about the patient's perspective even when they're in crisis, and to make sure our actions are truly in their best interests.
Yeah, it's a good reminder that even with the best intentions, our interventions can sometimes have those unintended negative consequences. So how do we avoid that? How can we make sure that what we're doing is actually helpful and not harmful?
I think it all comes back to understanding the patient's perspective. We need to ask ourselves questions like, how might the patient see this intervention? What are their fears and concerns right now? And most importantly, how can we make sure they feel safe and respected throughout this whole process?
So we need to be aware of that power dynamic, recognize our own biases,
Yeah.
and always prioritize the patient's well-being and their right to make their own decisions.
Exactly.
That's a lot to juggle.
It is. But luckily, we have tools and frameworks to help us. One of the most important ones is a thorough assessment process.
Okay, and the sources mentioned that mental health assessment is a two-stage process. What are those stages?
So the first stage is all about gathering information. We use the biopsychosocial model to guide this process. We look at their current situation, their medical history, their social support, basically anything that might be relevant.
Right, so we're gathering all the pieces of the puzzle,
Yeah,
but then we have to figure out how they all fit together.
exactly. And that's the second stage interpretation. We take all that information and try to make sense of it. Are there any potential diagnoses? What seems to be contributing the most to their current state? What are their strengths that we can build on?
So it's not just about collecting data. It's about using our clinical judgment
Yeah.
to figure out what the information means and then make decisions about care.
Exactly. It takes a lot of different skills, sensitive communication, careful observation, critical thinking, and being able to synthesize all that information from different sources to develop a plan that meets their needs.
It's like a reminder that mental health nursing is both an art and a science. You have to combine evidence-based practice with a deep understanding of human experience.
Absolutely. And remembering that each person's journey is going to be different. There's no one size fits all in mental health care.
Yeah, that's so important to remember. And it leads us to another important topic, the potential for harm in mental health care, even when we're trying our best to help. The sources use the term iatrogenic harm to describe this.
Oh, yeah. Iatrogenic harm is any unintended negative consequence of medical treatment. It's that reminder that even when we're trying to help, our actions can sometimes have unintended and even harmful effects.
Wow, that's a sobering thought. Can you give some examples of what that might look like? What kind of iatrogenic harm should nurses be aware of?
There are a lot of potential sources. Sometimes it's something simple like medication side effects. The medication might be helpful, but the side effects are really debilitating for the patient.
Right. Or it could be something more complex, like a misdiagnosis.
Exactly. If someone's misdiagnosed, they might get treatment that's not right for them, which can delay their recovery or even make their symptoms worse.
And I know the sources also talked about insensitive communication as another source of iatrogenic harm.
Absolutely. How we communicate with our patients can have a huge impact on how they're feeling. If a nurse uses language that's dismissive or judgmental or stigmatizing, it can leave the patient feeling ashamed and misunderstood and less likely to seek help in the future.
So it's not just about what we do, but how we do it.
Mhm.
Our words, our tone of voice, our body language, it all sends a message,
Mm,
and we need to be really mindful of the impact we're having.
exactly. It's about creating that safe and therapeutic environment where the patient feels comfortable sharing their experiences without being judged.
That's so important. It sounds like mental health nurses have a lot of responsibility on their shoulders.
It is a challenging role, but it's also so rewarding. And remember, you don't have to do it all alone. We have ethical frameworks, evidence based practices, and supportive colleagues to help us provide the best possible care.
That's good to hear. But it also sounds like ongoing education and reflection are crucial for mental health nurses.
Definitely. This field is always changing. New research is coming out, new treatment approaches are being developed. We're always learning more about mental illness. So it's important to stay curious, to keep learning, and to constantly challenge our own assumptions and biases.
That's a great point. Okay, so we've covered a lot of ground in this first part of our deep dive. We've explored the biopsychosocial model, the impacts of social determinants and ACEs, the complexities of diagnosis and assessment, and the role that mental health nurses play in managing stress and distress. But there's still so much more to uncover, right?
There is. And in the next part of our deep dive, we'll go deeper into those ethical considerations. We'll explore trauma informed care in more detail. And we'll talk about some practical strategies for building those all important therapeutic relationships with your patients. It's amazing how much we covered in just that first part of our deep dive. I mean, from that biopsychosocial model to those really powerful stories like Jessica and Shamim, it really shows just how deep and complex this field of mental health nursing really is.
It does. It's like we're peeling back layers of an onion, uncovering all these insights with every turn.
Mhm.
And I definitely want to keep exploring. You mentioned we'll be looking closer at the ethical considerations in mental health care. That's something that I always have a lot of questions about.
Yeah, it definitely needs to be considered carefully. As mental health nurses, you're often in these really difficult situations where you have to think about these ethical principles.
And I know the sources mention a few specific ethical dilemmas, like using restraints or involuntary treatment. Those are tough calls. How do you balance the patient's right to make their own decisions with the need to make sure everyone is safe? I mean, both the individual and the people around them.
Oh, they're really tough calls. And there's always that risk of iatrogenic harm, especially when you're talking about interventions that restrict someone's freedom. It's a constant balancing act. You have to weigh the potential benefits against the potential risks, and you really have to consider the patient's perspective and their rights.
It seems like open communication is so important in those situations, making sure that the patient understands what's happening, why decisions are being made, and what their options are.
Absolutely. Open and honest communication is key. It's about explaining why you're doing something,
Yeah.
exploring any concerns that the patient might have, and making sure they know that their rights are being respected.
And I imagine it's also important to be aware of your own biases, to make sure that your decisions aren't being influenced by assumptions or stereotypes.
That self awareness is so important. We need to be thinking about our own values and beliefs and how they might be influencing our interactions, even unconsciously. It's about striving for objectivity
Mhm.
and making sure that your actions are truly in the best interests of the person you're caring for.
It's a constant process of learning and self-reflection. You can't just assume you have it all figured out.
Right.
You have to be open to feedback, different perspectives,
Right.
and always challenge yourself.
You got it. Mental health care is always evolving. We're always learning. And our understanding of mental illness is always getting deeper.
So for nurses, how do you stay up to date?
Mhm.
And how do you make sure that you're providing the best, most ethical and effective care?
It's a mix of things, really. Formal training, definitely.
Hmm?
Keeping up with research. And that personal reflection that we talked about. Supervision or peer support can be really helpful. Going to conferences or finding opportunities to learn from other people.
So being proactive and recognizing that learning is a lifelong process, especially in a field like mental health that's always changing. Now, you mentioned that we'd also be talking about those practical strategies for building therapeutic relationships with patients. I really want to get into that
Hmm.
because it seems like those relationships are really at the heart of everything we do in mental health nursing.
Oh, absolutely. A strong therapeutic relationship is the foundation. It's about creating that space where the patient feels safe, heard, and understood. They need to know they can trust you and be open about what they're going through without worrying about being judged.
So, what are some of the key things that nurses should be focusing on to build those strong relationships?
Empathy is huge. Being able to really understand and share in your patient's feelings is so important. That means active listening, paying attention to their words and their body language, and trying to see things from their point of view.
So, going beyond just hearing what they're saying
Mm.
and actually connecting with the emotions behind the words.
Exactly. It's about acknowledging that their experience is valid and important, even if you haven't personally gone through the same thing.
Okay, and what about genuineness? The sources mention that as well.
Genuineness is about being authentic and congruent, being yourself, being honest, and being open in how you communicate. Patients can usually tell when you're not being sincere or if you're putting on an act. So approach these relationships with honesty and integrity.
So, showing up as a real person, not just a healthcare professional.
Exactly. And that goes hand in hand with another important quality, unconditional positive regard.
Can you explain what that means?
Sure. It means valuing and accepting the patient for who they are, no matter their behaviors, choices, or diagnosis. It's about respect, not judging, and believing in their inherent worth as a person.
So, separating the person from the illness.
Exactly. And it's important to communicate that acceptance both with your words and your actions. Show them that you care about them as a person, not just as a patient.
I imagine that can be hard sometimes, especially when patients are being difficult or making choices that you don't agree with.
It definitely can be. But that's where the unconditional part comes in. You hold on to that positive regard even when it's tough. You have to remember that everyone is doing the best they can with what they have.
That's a good point.
Yeah.
So, we've talked about those qualities of empathy, genuineness, and unconditional positive regard. What about specific communication techniques like those open-ended questions, reflective listening, and validation that we talked about earlier?
Right. Open-ended questions are a great way to get the patient to open up and share more about their experience. So instead of asking a yes-no question like, are you feeling anxious today?
Hmm.
You could ask, tell me a little bit about how you've been feeling lately.
Okay, so that encourages them to share more,
Yeah.
and it gives you a better understanding of what's going on for them.
Exactly. And reflective listening is another powerful technique. You basically paraphrase or summarize what the patient has said. This shows that you're really listening, and it makes sure you've understood them correctly.
So you're holding up a mirror to their experience,
Mm.
reflecting back what you've heard, to check if you're on the same page, and to show them that you're really paying attention.
That's a great way to put it. And then there's validation. It's about acknowledging and accepting the patient's feelings, even if you don't agree with them or you don't fully understand.
So instead of saying something like, you shouldn't feel that way, you might say, it makes sense that you're feeling frustrated given what you're going through.
Exactly. It's about communicating that their feelings are valid, even if you might have reacted differently in that situation.
These techniques seem so simple, but they can be so powerful for building that trust and rapport.
They really can. And they don't require any special training. It's just about being present, being attentive, and being interested in what the patient has to say.
Now, we've talked a lot about assessment and gathering information to understand the patient's situation. But the sources mentioned that assessment is an ongoing process. It's not just a one-time thing.
Right. That's a really important point. It's easy to think of assessment as something you do at the beginning, but really we should be assessing constantly.
So it's not just about that first interview or using a standardized assessment tool.
Exactly. Those formal assessments are important, of course. But ongoing assessment means paying attention to those little changes, changes in their behavior, their mood, their communication. It's something you're doing throughout your interactions with them.
So noticing those small details that might tell you that their mental state is changing or that their care plan needs to be adjusted.
You got it. It's about being really tuned into the patient, being curious, and being willing to change your approach based on their needs.
So you're always gathering new information and refining your understanding of the patient.
Exactly. And that shows how important it is to be flexible and adaptable in mental health nursing. You can't just stick to a rigid plan. You have to be able to respond to the fact that mental health is always changing. And you have to be willing to adjust your approach as needed.
It's about meeting the patient where they are in that moment and responding with compassion, with skill, and with a genuine desire to support their well-being.
Perfectly said. It reminds us that mental health nursing is challenging and complex, but it's also so rewarding. To see someone recover, to see them regain their strength and their hope, it's truly inspiring.
And speaking of inspiring things,
Yeah.
one of the sources mentioned the human library. I thought that was fascinating.
Oh, yeah. The human library is such a cool concept. Have you ever had a chance to participate in one?
Not yet, but I've heard amazing things. It's like a real-life library where people with lived experience become the books, and you can borrow them for conversation.
Exactly. It's a brilliant way to break down stigma and help people understand and empathize with others. You get to have a conversation with someone who has lived through something instead of just relying on stereotypes or secondhand information.
That sounds like such a powerful way to get rid of misconceptions and to create a more inclusive and accepting society.
And the research actually backs that up. Studies have shown that participating in the human library can really reduce prejudice and lead to more positive attitudes towards mental health.
It really shows how much power personal stories can have.
Absolutely. It emphasizes how important it is to listen to the voices of people with lived experience. They're the experts on their own journeys, and their insights can really shape how we practice as nurses.
So valuing their perspectives
Yeah.
and recognizing that we can learn so much from them.
And moving away from that old way of doing things, where the healthcare professional has all the knowledge. It's about being more collaborative
Mm.
and making sure patients are part of their treatment and recovery.
So shifting the power dynamic and recognizing that the individual is the expert on their own life.
Yes. And it's about empowering them to take charge of their mental health, to advocate for themselves, and to decide what recovery means to them.
That's a great message. But the sources also pointed out that recovery isn't always a straight line. There are often setbacks and challenges along the way.
Absolutely. Recovery is a journey. It's going to have twists and turns, ups and downs. It's really important to remember that setbacks are normal. They don't mean that you've failed.
So how can nurses support their patients when those tough times come up?
We'll start by recognizing that setbacks are normal. They're not just normal, they're also opportunities to learn and grow. Instead of looking at them as failures, you can help your patients see them as chances to learn and make adjustments.
So you're helping them build resilience, helping them develop those coping skills and giving them the tools they need to navigate those challenges and come back stronger.
Exactly. And it's about providing that consistent support and encouragement. Remind them that they're not alone and that you believe in them.
It sounds like patience and compassion are really important qualities for a mental health nurse.
Oh, they're essential. And remember to show yourself that same patience and compassion. Mental health nursing is demanding. It can be emotionally draining. So it's important to take care of yourself too.
Yeah, we can't pour from an empty cup. So we've talked about those therapeutic relationships, the importance of ongoing assessment,
Hmm.
the ethics of decision-making, and how recovery is a journey. All of these things are so interconnected. It's like they all weave together to create this tapestry of mental health care.
You're right. It's all connected. And it just highlights how complex and nuanced this field really is.
Mhm.
Mental health nursing isn't simple. It requires your full attention, your compassion, your critical thinking skills, and your dedication to providing the best possible care for your patients.
And that leads us to another really important aspect of mental health care, culture and diversity.
Absolutely. We can't talk about mental health without talking about how much culture and diversity matter. In fact, the sources had a great case study that shows this. Remember Tony?
Yes, he was a young man who was an informal patient in an acute ward. He had agreed to come back to the hospital to restart clozapine after he forgot to take it for a few days.
Right. And Tony's case brings up some important points about cultural sensitivity and how it can affect care.
I'm curious to hear more about that. How did culture play a role in his situation?
Well, the sources don't go into a lot of detail about Tony's specific background, but they do talk about how important it is to understand a person's cultural beliefs and practices. These can influence how they experience mental illness, what kind of treatments they prefer, and even how they interact with healthcare providers.
So we can't assume that everyone sees mental health the same way, or that our approach to care is going to work for everyone.
Exactly. It comes down to cultural humility.
Cultural humility, what does that mean?
So, cultural humility is a process of self reflection. It's about recognizing that you don't have all the answers. You can't possibly know everything about every culture, and you need to be open to learning from your patients.
So it's about being curious and respectful, recognizing that their cultural background is a big part of who they are.
Yes.
Okay, so how can nurses actually develop that cultural humility in their work?
It starts with looking at yourself.
Mm.
You have to be aware of your own biases,
Yeah.
the assumptions you make, and how your own background shapes how you see the world.
So recognizing that we all have blind spots
Right.
and being willing to challenge your own perspectives.
Exactly. And it's also about actively looking for information about different cultures. You can read books, go to workshops, talk to community organizations. You can even just have open conversations with your patients about their beliefs and practices.
So cultural competence is a journey, not a destination.
Right.
You're always learning and growing.
It's not about memorizing a bunch of facts. It's about respecting the diversity of human experience and being willing to change how you approach care to meet each person's individual needs.
It's about honoring their unique stories and understanding that culture is a part of those stories.
Exactly. And that brings us to another really important piece of mental health care, the social determinants of health.
We talked about this a little bit earlier with Jessica's story, how her anxiety was so connected to her financial stress and her lack of support.
Right. And the sources have another good example of this with Naveed. Remember him?
Yes, Naveed was seeking asylum. He was living in a center with a lot of other asylum seekers from all different backgrounds.
Exactly. And his case shows how things like poverty discrimination, social isolation, and bad housing can really impact someone's mental health.
I mean, seeking asylum is stressful enough on its own. Then you add on all the challenges of adjusting to a new culture, language barriers, uncertainty about the future, and for many people, past trauma and loss. It makes sense that mental health is a major concern for asylum seekers.
It really does. And the conditions in those centers can make things even worse. Overcrowding, no privacy-limited healthcare difficulty accessing support, those are all big stressors.
It's a reminder that when we're assessing and treating mental health, we have to look at the bigger picture. We can't just focus on individual factors. We have to consider all those social and political factors that are affecting people's lives.
Absolutely. It's about understanding how all those social determinants are interacting and recognizing that they can create real barriers to recovery.
So as nurses, what can we do to address those social determinants and advocate for a system of care that's more equitable?
It's a multi-layered approach. The first step is awareness. You have to educate yourself about the social determinants of health and how they impact your patients. You need to be able to recognize those factors and include them in your assessments and care plans.
So asking the right questions,
Yeah.
really listening to your patient's stories, and understanding the challenges they're facing beyond just their symptoms.
Exactly. And then it's about advocacy. You need to be a voice for your patients and advocate for policies and systems that get at the root causes of health inequities.
So that might mean working within your organization to challenge practices that are perpetuating those inequities, or maybe connecting with community organizations that are addressing those social determinants like poverty and discrimination.
You got it. It's about realizing that we have a responsibility to not just care for individuals,
Yeah.
but also to fight for a more just and equitable society where everyone can thrive.
And that advocacy starts with understanding the unique challenges that different groups are facing. Groups like asylum seekers, refugees, and other marginalized communities.
Absolutely. And it's about recognizing the strengths and the resilience of these individuals and communities, partnering with them to figure out what they need, and advocating for policies that support their well-being.
So we're moving away from that deficit-based approach that only focuses on what's wrong. And we're moving towards a strength-based approach that sees the potential in everyone.
Exactly. And that brings us back to that stress vulnerability model that we talked about before.
But yeah, the stress bucket.
Right.
It's a really helpful way to understand why some people can handle more stress than others.
It is. Remember how we imagined everyone has a bucket that represents how much stress they can handle? Some people have bigger buckets than others, meaning they can deal with more before it overflows.
And a lot of different things can influence the size of that bucket, right?
Absolutely. Genetics, personality, past trauma, social support, coping skills, access to resources, they all play a role.
So if someone has experienced a lot of stress or trauma in their life, their bucket might be smaller.
Exactly. Their bucket might be already partly full, leaving them with less room for new stressors. And that's why it's so important to understand those social determinants. Things like poverty discrimination and not having access to resources can make that bucket fill up faster.
It's like those social determinants are constantly adding more drops to the bucket, making it more likely to overflow.
Exactly. And when that bucket overflows, it can lead to a mental health crisis or make their symptoms worse.
So as nurses, our job is to either help people make their buckets bigger or to reduce the amount of stress that's going into the bucket.
That's a great way to think about it. We can help people build resilience by teaching them coping skills, connecting them with support.
Right.
and teaching them how to manage stress.
And we can also advocate for changes to their environment or to policies that are contributing to their stress.
Exactly. Mental health isn't just about what's going on inside a person, it's also about the systems and structures that shape their lives.
So we have to look at the whole picture and address both the individual and the systemic factors that are impacting their well-being.
Exactly. And it's about empowering people to be in charge of their own recovery and to speak up for what they need.
So recognizing that they're the experts on their own experiences
Mm.
and that their voices matter.
Absolutely. And that brings us back to how important those therapeutic relationships are. We need to create spaces where patients feel safe and valued and where they feel like they can share their stories.
Speaking of stories, you mentioned earlier that we'd talk more about trauma-informed care.
Yeah.
What does that look like in practice? How can we actually incorporate those principles into our nursing care?
Trauma-informed care is a really important framework for understanding and responding to trauma. It's about recognizing how common trauma is and understanding how big of an impact it can have.
Yeah, one of the sources said that most people who use mental health services have experienced at least one traumatic event.
It's true, and that's why it's so important for us as nurses to think about trauma when we're interacting with patients.
So what does that mean? How do you approach care from a trauma-informed perspective?
First, you have to acknowledge how common trauma is and understand how it might show up in a person's behavior, emotions, and relationships. You have to be aware that their past experiences can shape how they see the world and how they react to stress.
So you're not just seeing those difficult behaviors as symptoms of a mental illness, you're also considering that they might be coping mechanisms from past trauma.
Exactly. And you respond to those behaviors with compassion and understanding, not judgment or punishment.
One of the sources had a good acronym for the key principles of trauma-informed care: safety, trustworthiness, choice, collaboration, empowerment, and respect for diversity.
That's a great one to remember. Those principles are essential for creating an environment where people who have experienced trauma can feel safe and supported.
Okay, let's break those down a bit. Starting with safety, what does that mean in terms of trauma-informed care?
Safety is about making the environment feel secure, both physically and emotionally. It could be simple things like making sure conversations are private, being aware of your body language and your tone of voice, and avoiding anything that could seem threatening or controlling.
So you're making sure that they don't feel re-traumatized by their interactions with you.
Exactly. And that's also tied to trustworthiness. You build trust by being reliable, consistent, and open.
So doing what you say you'll do, being honest about your limitations, and being clear about your intentions.
Exactly. And then there's choice. It's about giving patients a say in their care, letting them make decisions that feel right for them.
So you're not telling them what to do. You're giving them options and helping them make choices that align with their goals.
Right. And that leads into collaboration. Trauma-informed care isn't about doing things to people. It's about working with them as partners.
Okay, so recognizing that they're the experts on their own lives and involving them in the decision-making process.
Exactly. And then there's empowerment. It's about helping people regain that sense of control over their lives.
So maybe teaching them coping skills, connecting them with resources, or just acknowledging their strengths and their ability to heal.
Absolutely. And finally, there's respect for diversity. Trauma-informed care recognizes that trauma affects everyone and that we have to be sensitive to the needs and experiences of different groups of people.
So taking into account things like culture, gender, sexual orientation, and socioeconomic status.
Exactly. It's about realizing that trauma can intersect with other forms of oppression, and we have to be mindful of that.
It sounds like trauma-informed care isn't just a set of techniques. It's more like a way of thinking, a whole philosophy of care.
It is. It's about changing your perspective, challenging your assumptions, and always trying to create an environment where patients feel safe, heard, and empowered to heal.
It's about recognizing how big of an impact trauma can have and responding with compassion, sensitivity, and respect for the individual's journey.
Absolutely. And it's a reminder that as nurses, we have a responsibility to advocate for policies and practices that support survivors
Yep.
and that promote healing and recovery.
Now, you mentioned earlier that we'd also be talking about recovery-oriented practice. Can you tell me more about what that is and how it's different from more traditional ways of thinking about mental health care?
Sure, recovery-oriented practice is a big change. It moves away from that old medical model that just focuses on reducing symptoms, and instead it focuses on the individual's strengths, their goals, and what they want to achieve.
So it's about seeing the whole person.
Yeah.
recognizing that they have hopes and dreams and a desire to live a meaningful life even with their mental health challenges.
Exactly. And it's about believing that recovery is possible, even for people who've been through a lot.
It's about giving them hope
Hmm.
and empowering them to take charge of their own recovery.
You got it. And that brings us back to that Shikami framework. Do you remember those 5 elements?
Let's see, connectedness, hope, identity, meaning in life, and empowerment. I can see how those fit in with recovery-oriented practice.
They really do. Connectedness is about building social support and that feeling of belonging. It's about helping people connect with others who understand what they're going through, people who can offer encouragement.
And hope is about believing that things can get better, that recovery is possible.
Exactly. And identity is about helping people rediscover who they are outside of their illness.
So recognizing that their mental health is just one part of who they are,
Mm.
and that they have other strengths and talents and interests.
Absolutely. And meaning in life is about helping people find those things that give their lives purpose and direction.
So maybe helping them reconnect with old passions or set new goals.
That's a great way to put it. And then there's empowerment. It's about supporting people to make their own choices and take control of their lives.
So giving them the tools and resources to manage their mental health, to advocate for themselves, and to
Mm.
build a life that feels meaningful to them.
Exactly. So you can see how CHIM really embodies recovery-oriented practice. It's about supporting the whole person,
Mhm.
about encouraging hope, connection, and belief in their ability to heal.
It's a really beautiful approach. It's inspiring to think about how we as nurses can be a part of that, supporting recovery and empowering our patients.
It really is. And it's a reminder that even when things are tough, recovery is possible. And everyone deserves the chance to live a meaningful life.
Now, the sources also talked about how mental illness affects families and communities too.
That's right. Mental illness doesn't just impact the individual, it affects relationships, work, social life, and the well-being of families and communities.
Yeah, they talked about Oysen. He's living with schizophrenia and struggling to find a job.
Yeah.
His family is really supportive, but they're also feeling the strain.
Oisen's case shows how important it is to take a family-centered approach to care. Families are often the main caregivers for people with mental illness, and they need support too.
So understanding how the illness affects the whole family, recognizing their strengths, and providing education resources and support that's tailored to their needs.
Exactly. It's about recognizing that families are part of the recovery process, and their involvement can make a big difference.
It's about giving them a voice and helping them find the resources they need to support both their loved one and themselves.
Absolutely. And we also have to remember that mental illness impacts communities. When people are struggling, it can affect their ability to work, go to school, participate in social activities, and be part of their community.
And it can contribute to stigma and discrimination,
Yeah.
which can make it even harder for them to get the help they need.
Right. So it's really important to address those social determinants of mental health, to advocate for policies that promote inclusion, and to work towards building communities that are supportive and welcoming to people with mental health challenges.
So mental health is a shared responsibility. We all have a role to play.
We do. And that brings us back to what mental health nursing is all about, the belief that everyone deserves quality care, compassion, and the chance to live a good life no matter what challenges they're facing.
It's about recognizing that everyone has value and providing care that respects their stories and their hopes.
Exactly. And it's about advocating for a system that's fair, accessible, and responsive to everyone's needs.
It's a big job,
Uh-huh.
but it's worth it. This deep dive has been really inspiring. I'm feeling motivated to learn more about what it means to be a great mental health nurse.
I'm glad to hear that. And in this final part of our deep dive, we're going to talk about some practical ways to manage stress and burnout. We'll explore why self-care is so important. And we'll talk about some of the exciting things that are happening in mental health care, the innovations that are shaping the future of this field.
Wow, it's amazing how much ground we've covered in this deep dive.
Yeah, it really is.
It's incredible how interconnected everything is in mental health care. From individual experiences to those broader social determinants, from ethical considerations to those powerful therapeutic relationships.
It's like we've woven this intricate tapestry revealing all the patterns and connections in this field.
And you're right, we still have some really important threads to explore, like managing stress and burnout, the absolute necessity of self-care for nurses, and all of those exciting innovations that are shaping the future of mental health care.
Absolutely.
You know, it's interesting you brought up stress and burnout, because as we've been talking about all these complex and challenging aspects of mental health nursing, I can't help but think about the toll it takes on the nurses themselves.
Yeah, it's a very valid concern. Mental health nursing can be incredibly demanding,
Mhm.
emotionally and physically. You're constantly exposed to other people's pain and trauma and suffering, and it's bound to have an impact over time.
The sources really highlighted the high rates of burnout and compassion fatigue among mental health nurses. And it's a serious issue. It can affect the well-being of the nurses, of course,
Hmm.
but it can also affect the quality of care that they're able to provide.
Exactly. When we talk about burnout, we're talking about emotional exhaustion, depersonalization, and a reduced sense of accomplishment. It can lead to cynicism, detachment, and a lack of motivation.
And compassion fatigue is that feeling of being emotionally drained and depleted. After being exposed to other people's trauma for so long, it's like your own empathy reserves have been completely exhausted.
That's a great way to put it. And it's so important to remember that these aren't signs of weakness. They're actually signs that you care deeply and that you're invested in the work that you do.
It's like your heart is getting bruised from carrying the weight of other people's pain.
That's a beautiful way to think about it.
So as nurses, how can we protect ourselves from burnout and compassion fatigue?
Well, the sources emphasize self-care, but what does self-care actually look like for busy nurses? I mean, you're juggling demanding work schedules, family responsibilities, and your own personal life.
Yeah, that's a good question. And it's not a one-size-fits-all answer, is
But
it?
no, it's not.
Yeah.
Self-care is about finding what works for you, what nourishes your mind, body, and spirit.
So it's not just about bubble baths and face masks, although those can be nice.
Of course.
But it's more about taking a holistic approach to well-being. It's about paying attention to your physical health, getting enough sleep, eating healthy foods, exercising regularly, but also paying attention to your emotional and mental health.
Yeah, absolutely.
So making time for things that bring you joy, connecting with loved ones, maybe practicing mindfulness or meditation, setting boundaries to protect your time and energy, and seeking professional support when you need it.
You've got it. It's about making self-care a priority, not just something you squeeze in if you have time.
Because if we're not taking care of ourselves, we can't show up for our patients. We can't pour from an empty cup.
That's such a great analogy. Self-care isn't selfish, it's actually an act of service, both to yourself and to the people you care for.
It's about recognizing that your well-being is essential to providing good care. Now, you mentioned earlier that we'd also be talking about the innovations that are shaping the future of mental health care. What's on the horizon?
So many exciting things. One area that's really taking off is the use of technology in mental health care.
Yeah, I've been hearing a lot about telehealth and mental health apps. How is technology changing how we deliver care?
Well, for one thing, it's making mental health care more accessible. Telehealth lets people connect with providers remotely, which is huge for people who live in rural areas or have mobility issues, basically anyone who has trouble accessing traditional care.
And mental health apps can provide support and resources to anyone with a smartphone.
Exactly. There are apps for tracking your mood, managing anxiety, practicing mindfulness, connecting with support groups, all kinds of things.
It's amazing how technology is breaking down those barriers
Yeah.
and making it easier for people to get the support they need.
And it's not just about access. Technology is also helping us develop new treatments. For example, virtual reality therapy is showing a lot of promise for things like PTSD and phobias.
Oh yeah, I've heard about that. It's
Mm.
like you're immersed in this virtual environment
Yeah.
and you can safely confront your fears.
Exactly. And it can be really effective because it allows people to gradually expose themselves to their triggers and practice coping skills in a way that feels safer than real life.
That's incredible. It feels like the future of mental health care is happening right now. But with all these advancements, it's important to remember that technology is just a tool. It can't replace the human connection that's so important in mental health care.
You're absolutely right. Technology can enhance our care, but it can't replace empathy, compassion, and understanding.
It's about finding that balance,
Wow.
using technology to our advantage while still maintaining that human touch.
Exactly. And that brings us back to all those core values we've been talking about. The importance of seeing the whole person, understanding the impact of social determinants, upholding ethical principles, building those strong therapeutic relationships, and providing care that's trauma-informed and recovery-oriented.
Those values are the foundation of excellent mental health nursing.
And they're values that you can carry with you throughout your career, no matter what changes the future brings.
As we wrap up this deep dive, I'm feeling really inspired and empowered. inspired by all the incredible work that mental health nurses do,
Hmm?
and empowered by all the knowledge and insights we've explored together.
It's been fantastic discussing these topics with you. I hope this deep dive has given you the tools and perspectives you need to continue providing compassionate and effective care.
And remember, you're not alone in this. There's a whole community of people who are passionate about mental health. Professionals, researchers, advocates, and people with lived experience. We're all working together to create a world where mental well-being is valued and supported.
So keep learning, keep growing, keep connecting, and keep making a difference. The future of mental health care is in your hands.
And that's a wrap on this deep dive on mental health and nursing. Thanks for joining us, and we'll see you next time.